Hello, my name is Anna Pattison. For the past 40 years, I've been a dental and dental hygiene educator. Very early on in my teaching, I realized that you can't learn this skill from textbooks or from looking at pictures and manuals. Video demonstration is the key to effective teaching and learning of periodontal instrumentation. Angle the probe so it's going to go down for the mandibular teeth and get our grasp, our modified pen grasp, and then we'll establish a fulcrum here on the occlusal surfaces of the premolar teeth. Now we're going to adapt the tip of this and practice some probing strokes. Adapt to the distal of the first molar here. Take a reading. Walk gently, keep the probe against the tooth, pause on the buccal, take a reading there, and then very gently, this is a very relaxed modified pen grasp we're using, and then when you get to the mesial again, rotate your handle out toward the buccal so you can angle slightly to get your mesial reading. Today, through the power of streaming video, I'm able to present videos to you on demand. You've got a firm modified pen grasp, and let's do the distal first on this tooth, and then look at the stroke, overlapping oblique strokes on the buccal, rotate with your thumb at the line angle, and do overlapping strokes on the mesial. Insert like this at the midline, and then do overlapping strokes, and do the mesial surface of the canine. We're going to do the mesial of this lateral. Now right here I'm keeping this lower shank really parallel, but sometimes if you keep this parallel, you have to be careful not to poke into the tissue here if the tissue is really tight and the sulcus is shallow. If the pocket is deep, you definitely want to be parallel here so that you can go deeply into a pocket like this. You will be able to view these at your own pace as many times as you want. We'll start at the distal line angle and use a series of short overlapping strokes on the buccal and rotate this blade around to the mesial and do overlapping strokes across the mesial and then up to the contact area. Let's go to the next molar. Close up, go down, open up by lifting up, and then do a series of strokes across the distal surface. If you insert this and you lean the shank away from the tooth as you make the strokes, you see the point or the toe of this is going up toward the contact, and you would miss calculus down at the base of the pocket. So this is why we need to upright the shank, make sure that it's parallel with the distal surface and parallel with the long axis of the tooth, so the tip of the instrument will go down to the base of the pocket as we are scaling and doing overlapping strokes going up to the contact. So, I invite you to explore this website. I look forward to teaching you. Welcome to the Pattison Institute.